Hey there, Eileen. Well, according to the CDC, approximately 12% of men in the United States have fair or poor health. For Men's Health Month, the Men of Alpha Phi Alpha Fraternity Incorporated is encouraging men to get up and get tested. President Dr. James B. Massey Jr. and Dr. Torrance T. Brown are here to discuss their upcoming Men's Health Forum. Welcome to Good Morning Washington.
Thank you so much.
So important because men, they put themselves last, it seems.
Absolutely.
And it seems like they always have an excuse, gentlemen, for getting to the doctor. I'm going to start with the first question here and to you, doctor, and that is for men who don't want to go and always have an excuse. How do we, as women, the ones who love them, how do we get them to go?
I think just stressing the importance of taking care of oneself and stressing the importance of how health impacts the family. So if the men's not healthy, then the family's not healthy. So trying to stress the importance of not just health implications for the man, but for the family itself.
And James, should you ever use, you think, an example of, well, so-and-so went, when are you gonna go?
Absolutely, just encouraging each other. I think the encouragement, opening the door for the conversation to happen, that's the most important as well. The more that we can talk about it as family, as community, as brothers, the more that we can encourage each other to be able to do what's necessary for the best health for the long run.
Now, when it comes to the issues that are facing men today, doctor, what are the ones when you're in your 30s, your 40s, your 50s? I know prostate cancer is probably one of the ones at the top of the list, but what do men face today?
Absolutely, prostate cancer, cardiovascular health, and also diabetes. And diabetes, men tend to go untreated or not take care of themselves as relates to diabetes. And also the same thing with cardiovascular disease. We're also finding that men are doing a good job of taking care of themselves and maintaining their health in those areas.
This was the second year now that we're going into having this forum. James, it was so popular last year, nearly 100 men in attendance. What did you learn last year that you're doing different this year?
We wanted to double our efforts. We learned that there were different things that were facing our community that were not being touched on. One of those things was mental health. You know, talking about mental health, talking about those things that really weigh on men in a very different way, and really encouraging those to really have those conversations about it. That's the first step, especially with mental health, is just acknowledging the fact that it's okay to want to talk about issues that are pressing on you.
So during the course of this 6-hour event, this forum taking place this Saturday in Greenbelt, men will get a chance to ask questions. They'll get some great advice. Of course, it's not like everything is going to be answered during that day. So how does it work after that?
So we'll have the forum, and we'll provide these educational sessions and opportunities for people to engage with providers. And that was the main goal of the forum, to provide education piece and then provide opportunities for participants to engage with the resources in the county, sort of see what's available, and we'll also be imparting the participants with information to sort of keep track of that information so they have it at their fingertips, the resources, the available opportunities to be engaged in sort of health activities in the county.
And of course, when it comes to men's health, we mentioned prostate cancer being one of the things at the top of the list, but when it comes to ethnicity, when it comes to age, what are we seeing more specifically in Maryland and even in Prince George's County?
Right, so certainly prostate cancer disproportionately affects African-American men compared to white men in the county, and that's national as well. But we're also seeing that playing out in Maryland and Prince George's County.
And last year, I mentioned the success of this event was so big. You mentioned mental health, that too huge for the health of families living in this area. I know that you're getting the word out, not just being here in Good Morning Washington, but also with some of the local churches.
Absolutely. We've been partnering with our communities, our churches, to really impress upon our men's ministries and those that are involved in community engagement to open the door for these conversations to happen. In addition to that, we're doing screenings. Things that a lot of folks don't get to the doctor, we're going to bring those services to them so they can be able to get their blood pressure checked. They can be able to even be screened for HIV and knowing their status. So we're not only just talking about it, but we're actually putting action behind it and encouraging people to do it on the spot.
And finally, what do you want men to walk away after this event with?
Well, the theme for this year's forum is men plus health equals power. So we're trying to change the narrative. So we're trying to turn the tide on some of these numbers. We're trying to impact the community, provide education, information, and resources. So we want them to walk away feeling empowered. Want them to walk away feeling that they can, this is something they can do, something they can manage and take control of, and that it will ultimately provide greater outcomes for the community and for the families.
Gentlemen, Dr. Brown and James, yes. I love that you guys are doing this. It is so important. Men can come by themselves, with their friends, with their families. Such a great event this Saturday, Crown Plaza there in Greenbelt, 10 to 3 p.m. Thank you so very, very much. Hey, still ahead in Good Morning Washington, kids around town this morning giving us a preview of the Airborne exhibition. But first, here's your play of the day.
Good morning, Washington. Happy